Scott County, providing safe, healthy, and livable communities.
All right, let's try this again. Good morning. Thank you for hosting us this morning. We're here today to talk about the Drug-Free Communities Initiative. And do you need okay. All right. The key to this initiative really is about prevention, and specifically about prevention for youth. It is not as simple as just prevention, but that is certainly kind of the starting point. And you are all very familiar with the benefits of looking at early intervention and prevention and how that saves pain and suffering for our residents as well as taxpayer dollars in more deep-end services. We're going to hear today a little bit about community building and that the Drug-Free Communities Initiative is more than a Scott County operation, that this is really a way to engage the community and to work together. And even within Scott County, you're going to hear about work across departmental silos and really trying to maximize our resources for the best outcomes for people. Finally, this group has done a nice job, I think, of including their evaluation methodology in the final pages of the packet. And so my hope today is that we can talk, their data really spells out much about the problem, and their evaluation talks about what we're going to look for to know if we've made a difference. What I'm hoping we can talk about today is really what's in the middle. What are those steps? What's the work that's going to get us from where we are today to those outcomes that we're hoping to achieve? So with that, we have really a very fine panel this morning. I'm going to ask the folks in the room to introduce themselves first. Then we do have a few speakers that are presenting remotely. So Katie, would you mind starting?
Yep. Hi, I'm Katie Morris. I work with Lil as an assistant. I work 14 hours a week, and full-time I am an educator and live in Scott County with 4 kids.
Thank you for being here.
Thank you. I am Lil Pinheiro, and I am the Drug-Free Communities Coordinator for the Scott County Public Health Department. I have, almost 12 years experience with this grant in particular and youth substance use prevention. So I'm really happy to be here and discuss this grant with you. It's him.
Right.
Whoa.
We could try that. Apparently it's not me anymore.
With a 3. Do you have a number 3 on it? I have a 5.
There's always one in the group. And generally, if you don't know who it is, it's probably you. Good morning, I'm Chris Wilton. I'm one of the judges here in Scott County. It's nice to be back before all of you.
Thank you for being here this morning, Judge. Lisa Brodsky.
Hi, I'm Lisa Brodsky, the Public Health Director for Scott County.
Dr. Wilcox.
Yeah, good morning. Mike Wilcox, Medical Director for Scott County's Community Health Services, and also provide services in the jail. Have a jail clinic.
Thank you for being here this morning. Teresa, are you able to be with us this morning?
Yep, I'm here. Good morning. Teresa Fouch, Data Planner for Public Health.
Thank you very much for being here as well. All right, I'm going to start out and just draw your attention. We're going to go right into the data this morning and then come back to some bigger picture questions. So on page 6, there is some information about what students reported about their use of substances within the last 30 days. And this data comes from the Minnesota Student Survey. So I'm wondering, like, it led me just right out of the gate to think about prevalence. And what do we know or think we know about the prevalence of opioids specifically in Scott County? Opioids is one of the targeted drugs for your grant. And what do we know specifically about that? Can somebody talk about the prevalence and kind of what led you to even start this initiative?
Sure. Well, one of the things that we do with our grant and what's required is to use a strategic prevention framework model. And with that model, it starts with assessment. And that's why we do the data collection and whatnot. And Teresa can talk about more. The Minnesota Student Survey is one of our pieces that we use for this grant in particular because it has this data point of past 30-day use. And as you can see here, we have some data to support that there are youth use in our county. In particular with opioids, one of the biggest concerns is 4 out of 5 people that report using heroin started with prescription drugs. So for us, if it's one person, it's too much. If it's one youth, it's too much. So we look at the data and if that's even remotely showing that our youth are dabbling in it or are experimenting in opioid use, then we really want to tackle that head on, as we would with any other substances. And that's why we identified opioids or prescription drugs as one of our priorities, underage drinking prevention, as well as marijuana prevention. So the data really drives us to identify there's a problem, there's an issue, and then we take the steps to build capacity around our table to make sure that we have the right people around the table to work on this. So it's more of a comprehensive environmental instead of an individual take on what we can do to not just do individual prevention work, but also do it so that it's the community. And so it's a bigger pool that we're working with.
So one of the things is I
Hey,
looked at,
Chris.
yes.
Oh, I also, this is Lisa Brodsky. I'd also like to add, and Dr. Wilcox can attest, a lot of the people that we're finding that are incarcerated or have substance abuse issues, particularly with opioids, a lot of them started with alcohol. And we have in Scott County, our youth alcohol rate is quite high. It's higher than the state average last time I checked in 2019. And so we want to really we don't want to be reactionary to when it gets to that point where they're using opioids. We really want to get in front of that and do some prevention activities.
Yeah, I certainly agree with that. Many of the clients that I work with in the jail have issues related to chemical dependency and issues related to criminal activity tied in with that. So we need to get that taken care of early on.
One of the things, just looking at this first slide. One of the things looking at this first slide is that that the increase between 2016 and 2019 of students who reported vaping or use of e-cigarettes. And I'm wondering if someone could speak a little bit to how work with the cities is targeting this data, or what this data drives forward for you.
Yeah, I can take that one. So vaping has become kind of the new epidemic. Cigarette use, traditional tobacco cigarette use is way down. Vaping use is way up. You can see in the numbers. And some of the previous, there might be other slides that talk about it. The vaping didn't even show up on some of the data from 2015 and 2016. It was a 0. And now we're at 17.9%, or in the city of Prior Lake, the Minnesota Student Survey data said 28.7% of 11th graders had vaped in the last 30 days. So actually tonight, there's a public hearing in the city of Prior Lake to ban flavors, with the exception of tobacco and menthol. So every other e-juice flavor, that would be the first city in Scott County to do so. They were also the first city to do the social host ordinance law a number of years ago. And there's a huge tie between the vaping of nicotine as that transitions into the vaping of marijuana, which is one of our initiatives. Technically, vape belongs to SHIP, which I know SHIP has been here before, but we partner with them. Jamie Carlson will be educating the council tonight as well. But they tie very closely, the vape and the marijuana, because the delivery device is the same. So really the elimination of the flavors makes it less attractive to youth. Judge Welton, do you have anything to say about that one?
Well, the only other piece I'd say is, for most of us, when we grew up, we remember all the commercials and all the tobacco ads targeting kids. The Camel, the whole number of initiatives, obviously all those are eradicated. And what's interesting is it has literally come back full force in just a different form. No longer do they have to put out commercials and pay for it. Now they have all of the devices, including Snapchat, all the things that kids are using, and they are bombarded by ads constantly. If you go on YouTube, you can take a look at, there are names of these people who get paid to show how to vape, and the newest things coming in and everything else. And kids,
Quiet.
the interesting piece also is that that's the short term, but really the long term is when.
Mr. Chairman, can we have Judge Wilton's microphone turned on? I can hardly hear what he's saying.
Yeah.
I'm green. Yeah, maybe slide.
Mine.
Commissioner Beard, how is that? Oh, that's really loud.
Much better. Thank you. Yeah,
Okay.
there you go. Thank you so much.
And so in the short term, vaping is a gigantic issue, and I know that all of you have read about the levels of nicotine in vaping. I don't want to say that cigarettes are safer, because they're not, but we've all heard about all the lung issues that our kids are having. The states that are now legalizing and have legalized marijuana, as Katie said, it's the same device being used not only for marijuana, but to use heroin, to use methamphetamine. And they are hidden devices, things that look like cell phones, things that appear to be USB drives are all used to vape marijuana, the juices, everything else. And interestingly enough, in the last, I think, 2 weeks, we've had a legislator from Savage who has introduced or partly introduced a bill to legalize marijuana again. It's not an if. I mean, this is going to be a when. And for better or for worse, we are going down that road. And as Chris said, we have a chance to potentially try to get ahead now. If we wait, and I think Lisa said the same thing, if we wait too long, we are going to be on the back end of prevention and treatment and everything else. And so the City Council in Prior Lake will take up tonight testimony, and my hope is that they will try to eradicate the flavors. And I know that you guys know about the flavors, but interestingly enough, the names of the flavors tell us everything we need to know, right? I mean, it's mother's milk, it's straw nanners. I mean, it's everything that's targeted to everybody who's a 12 and 13 and 14-year-old. And if they can get the 12 and 13 and 14-year-olds hooked on the good flavors, then they're life suppliers to our young kids. Interestingly enough, I would tell you also that I think 100% of my treatment court people started alcohol and marijuana. And then, as we know the progression, right? We go to prescriptions for mom and dad or an injury, and then we move to heroin, meth, and now, of course, everybody's brilliant because they are taking meth and heroin and marijuana and wax, and they're mixing in fentanyl. And fentanyl just makes it that much more powerful, and the high is that much more fantastic, apparently. But we also know is that fentanyl kills people dead instantaneously. So bottom line is that we're hoping that Prior Lake moves and then is followed along. And I know that there are a lot of opponents to, again, government trying to come in and do things. But at least from my perspective, when we start talking about kids, this is why we are here. This is what we should do. So,
Judge or panel,
Yep.
Ron Holsworth, Scott County Attorney. I want to ask you a question that I get from constituents when I'm out and about, and they're talking about the flavored vaping and marijuana. They're like, Ron, the legislature is legalizing marijuana, and you're fighting against flavored vaping. seems kind of weird. Why aren't you fighting against legalization of marijuana? And you're wasting your time on flavored vaping. And I give them my answer, so I want to see what your answer is to that.
My answer is exactly what I said before. You know, if we don't target kids using alcohol, if we don't make it difficult at best for kids to get alcohol and or marijuana and or prescriptions, not everybody that uses marijuana will go to heroin, but so many do. And, you know, the formative years of 12 to 25 or 26, I mean, you think about when our brains fully become functional. For men, that may never happen, I'm not sure. For women, it's a lot earlier. But when we mess with our brain tracks, and there are so many studies of showing kids at 17 who've used marijuana and what their brain looks like versus kids at 17 that don't. It's crazy. I mean, they rewire their own brains. And I've got a couple people in my treatment court who are strictly marijuana users. And they're young. One of them has just turned 21. And it's difficult for him. I mean, it might as well be heroin. I mean, he struggles to stay off the THC like you can't believe. And so I think the short answer, Ron, is this, is that the vaping will lead to the marijuana. And I don't think marijuana will lead generally to the vaping, but I don't know that. And so when it comes to kids, we should fight against both. It's a losing battle, I think, in some respects, but you know, in the end, you talk about costs, you talk about budgets, you talk about the money coming in. We're about to spend all of our money on our kids and dealing with addiction. I mean, if we think we've seen addiction now, you know, these states that are making a lot of money, they're going to need it because the health effects and what is happening to the youth, it's devastating.
Ron, I
So-
would also say that it's a progressive, things are progressive. It is very rare. I mean, it happens that kids jump instantly into smoking marijuana, or now the prevalence of edibles and things make that easier for them to jump straight from doing nothing into marijuana. But in the past, minus the edibles, minus brownies, things like that, it's very rare that kids would start smoking marijuana without having first smoked something else. So it is a gateway you know, cigarettes were a gateway into something else. Now vaping is the gateway because the flavors make it so much more appealing. So I would say that's why you need to tackle the vaping in addition to what's coming with marijuana.
And I would just like
I'd
to say
also,
that we are doing prevention work. So part of prevention work seems to be a game of whack-a-mole. A lot of the times we say that because you'll start dealing and tackling one issue in prevention, say marijuana, and then something else pops up like synthetic bath salts or, you know, K2 spice, synthetic marijuana. So we're constantly working on things. I don't think that it's that we're not working on marijuana legalization prevention or at least tackling that issue. We're dealing with all of it. So that's why in our grant, you see we have 3 priorities because we know that there's an importance in working on all of this. We also look at, you know, going back upriver. So, and also seeing what's happening or what's causing coping with substances. So we're trying to work with people that work with mental health issues so that we can deal with, okay, so what drives someone to start coping with substances? A lot of the times people don't know how to cope with things. So if we give them the tools to cope differently, and hopefully we'll mitigate some of those issues that come along with it and break the cycle of families passing on substance use to their youth and whatnot. But we are looking at all those pieces. It's not like we're just working on flavor banning and not looking at the importance of why are we have marijuana legislation at the table. What do we want people to do? And, you know, put those safety nets in place. Look at the lessons learned from Colorado and other places that legalize because there are issues that they had to backpedal to deal with, like potency issues. A cookie, an eighth of a cookie used to be the dosage in Colorado. And then they realized people were not feeling anything at an eighth of a cookie and eating an entire cookie and then having mental breakdowns and having psychosis and Sometimes that led to suicidal ideations and whatnot. So then they realized, well, okay, we can't have a dosage of 1/8 of a cookie. It has to be an entire cookie. So they had to backpedal legislation to fix that. So we are looking at those pieces and wanting our legislation and our elected officials to look at those pieces as well and get educated on that. And so that's why we exist, to do prevention work. And I think it's very important, yeah.
Yeah,
I just want to add, from a public health perspective, it really isn't an either or.
Right.
We're really tackling all substances. We take a very strength-based approach. A lot of the protective factors that you see for marijuana are the same for tobacco, are the same for methamphetamines. It really is, it's looking at those protective factors that help youth in particular make good choices. We know a recent study I read indicated that youth who smoke tobacco before or use any kind of tobacco product before the age of 18 are 25 times more likely to get addicted to opioids or to try opioids. So again, it's all of them from a public health perspective, not just picking
Those are all
and choosing.
answers I give in some form or another, but I just wanted to ask that, as I get asked that quite frequently.
Sure.
And people watching might have that on their mind.
Yeah, thank you.
I'd like to ask just one other question, and then I'm going to hand the microphone to Steve. How will it change? Well, let me ask a better question. When you talk about the work of this grant, and you've mentioned a couple very specific things, some public education around flavor bans. You talked about some community education pieces. What other steps, like you guys have done a very fine job, I think, in this packet of laying out what the problems are that we should be paying attention to. But what's the specific work? When you say we do prevention work, like tell me more about what exactly that means.
So we've identified some areas that we really want to focus on. The first one are community partnerships. We certainly don't think that government exists to fix all of this for people, right? There's strength in nonprofits, in faith-based organizations, in schools, in intergovernmental agencies. So we've identified, I'll give you an example. This Thursday, we have starting a mom's recovery group at Bethesda Church. So it's specific to women. Some of the women are participants in treatment court. Some of them are not. They're friends of friends. So the specific work is saying we've identified there's a problem, right? These people have been in drug addiction. They are now our moms. And all of the women that have RSVP that are coming are either pregnant or parenting. So we're doing prevention work with their children. We're offering support. We're offering a free meal, which comes from River Valley Church. We have some other faith-based like Shepherd of the Lake is interested. They're a member of our coalition and participating and doing some sponsorship of activities. There's childcare in the gym provided by volunteers. So like that's an example of something that starts this week in terms of community partnerships that we're really passionate about. So I would say community partnerships. Also within our agencies, and I'll have Judge Wilton or Lisa talk kind of about the public health nurse, but there's been a public health nurse that's been now invited to participate in the treatment court team. You want to talk a little bit about what she's doing?
Yeah, I mean, we've talked about this a couple months ago, but Angie from Public Health now sits on our treatment court team. And so she is in its staffing. She is monitoring at least one of our young ladies who is 8 months pregnant. This young lady has mental health issues, chemical dependency issues. Since she's been in treatment court, she's gone through 12 separate treatments. And she's on a CADDY waiver for mental health pieces. But she's over 110 days sober now. And through Angie and others, they're monitoring her. So not only do I have her probation officer on top of her, but now I have her public health nurse who is making sure that she's making her appointments, that she's taking care of that baby. This young lady now has a job. She's going to move into her sister's house. I mean, this is one of those that if you would have told me a year and a half ago or 2 years that we would be here with her, I would have had my doubts. But through all of the support system, and including Angie in public health, she's going to be a success story. It's an amazing transformation. And so, Commissioner Beer, we've talked about these silos, and they're still there. I mean, I don't know that we'll ever eradicate silos, but I would tell you that, we have the court system silo and we have public health silo, and it's an amazing movement to have somebody from public health sit with us. And when we talk to Angie, we don't just talk to her about what's happening with this young lady, but people bounce things off her to say, okay, we need to get her a car seat. And then Angie is there to say, we have this, we have that, we have potential, these grants. And so it just clearly strengthens our program to have public health involved. Lisa and I have spoken also about a possibility of having a liaison between public health and our Veterans Court and our drug court. There are so many things that come out through public health that never hit my treatment court and never hit my people. We just don't know about them. They come in there somewhere in the stratosphere and everybody else knows, but it never comes down to the ground level. And I know Lisa had talked about finding money for somebody like Katie to come in potentially and say, 3 or 4 or 5 hours a week to get those services that are being offered somewhere to come and get them to our people. There's just, again, this level piece that it never makes its way down. And so I know that something like that would benefit my veterans and my drug court people immensely. And so we're working on breaking down those barriers and getting to the kind of the real world, get your hands dirty type issues. And I'll tell you, this initiative in public health is interesting, especially the initiative, because when I was interviewed as part of this, not knowing what public health really did, other than I thought there are nurses and they go out and they help people. I'm not sure what people they help, but they help people. And when I was asked the question of this initiative and drug prevention, I said, I'm sure it happens, but I don't know about it. And I think most of the people interviewed said the same exact thing, which is, I'm sure people are doing things, but I don't know about it. And so it's kind of that back to, is it the real world? Are we doing the things on the ground? And so like Katie talked about this event on Thursday that's going to happen twice a month, sponsored in part by Public Health, bringing all these moms together who are recovering addicts, many from my treatment court. And in fact, the other day I ordered somebody to participate in this. She's pregnant, 8 months, and she needs it. She needs other moms to be able to tell her, A, you got to stay sober, and B, this is how you be a mom. I mean, here's what day 1 looks like. Here's what day 13 looks like. This young lady has nobody like that in her life to steer and direct her. And so what better group than somebody that's walked in her shoes, literally and figuratively. So, and so there is so many things that this group is doing. I know Dr. Wilcox can talk about the MAT, which from my perspective is gigantic in the jail. I mean, it used to be that our drug court people would go and the jail wouldn't let any drugs in. They would have to go cold turkey. And then when they came out, of course, they were at a gigantic risk to go use an overdose. And it happened over and over. And so what I'd like the commissioners to know is that at least that how I'm paying attention, that it seems to me that things are actually happening, that the movement, it's not just we're going to target the schools and say, hey, don't smoke, and we're the DARE people. I probably just dated myself from the 80s, but this is actual get in, get your hands dirty, and be part of the community. Lisa's done a great job with the grants and everything else, but grants are grants. And unless you have people that go and push and continue to push, it's not effective. So we're in a real good spot, and things are actually happening, which is exciting.
That is exciting.
This is
Steve?
Lisa Brodsky. I just want to add, and thank you, Judge Wilton. You used some really key words that I wanted to echo. Transformational. This has been really transformational for us, from moving to public health with a capital P, capital H, to little p, little h throughout the county. We have more of it's a paradigm shift where we're really thinking across the board. How can we be more public healthy, I'm going to say, in the jail, in treatment court, in other programs right across the county, so we're not working independently basically on the same problems. The other piece, the word initiative, this isn't really a program, this is initiative. Again, this is a paradigm shift. Part of the Drug Free Communities program really targets that coalition building in the community. We have gone in Scott County from a community that their perspective normalized alcohol use, was in great denial that we had an alcohol problem among our youth when we had a higher rate than the state overall, to a community that really accepted and identified substance use among youth as the #1 health issue in our county, as well as among adults. So even just that alone has been a huge difference in our community, where we're getting that community buy-in, where they're supporting initiatives, where they're participating in the messaging, where we have parents' attitudes and perspectives about alcohol changing. So they're getting messages, youth are getting messages not just from the government, from the county, but really from the community as a whole. And it really is, it's a community problem, and it takes a community to fix the issue, not just one entity.
Good morning. I'm Steve from the Office of Management and Budget. Going down the same lines of the partnerships, at the beginning of your documents, you've done a great job putting the information together. You have that things that are working well are the partnerships that have been able to come together, work together. But then looking at what's not working so well is that it appears that working with the schools tends to be a weakness right now. And some of it may be due to COVID situation at this time, but it really appears that the schools could be a really valuable partner with us. What are your plans in the future to more bring them in, or what barriers are there at this time?
Yeah, COVID has been a barrier, but it's also brought light to people are using ways to reach youth differently. So one of the things actually we were able to do, and we started, and we identified that as an issue too, like you're bringing to light, but we had a mini grant that was given to us from the Minnesota Region Prevention. And so that prompted us to talk to the schools, and the principal from Shakopee High School said, hey, we had this CAPS program with students, and maybe that would be a good way to use that. And we approached their Students Against Destructive Decisions as well, their group chapter. And we actually have youth as a part of our coalition, as well as schools. We have sectors that are represented in our coalition, 12 and more. We're not limiting ourselves to 12, but schools and youth are a part of that. So we have a youth representative, we have school representatives. Also, through that CAPS program, we were able to work on 2 different projects, one with the healthcare students and one with the creative media students. So we had the creative media students work on presentations to varying audiences. So if they could come in front of a county board, if they could go in front of their peers, let's create some presentations that make sense. That idea or the premise of not for us, without us, we really want to work with that so that we have youth at the table, their voice at the table, because it would seem very weird. I'd like to think that I was in battle, but the truth is I am not with what's going on now. And I'm not a social media influencer or anything like that when you're talking about that. So I've come to terms with that, and I understand that I need their voice to help me get to them. So we brought youth in that way through the CAPS program at Shakopee. That's actually brought that to light to other schools. And after the residence report, when that launched, I had 3 emails then immediately from different entities, and one of them was from a different school, a chemical dependency counselor asking to connect with us and wants to be a part of the coalition. So this has been really wonderful in this last year in building those relationships with the school. And we have also the Southwest Metro Alternative School asking for us to do some teacher in-service or professional development on drug trends. So building those outlets into, or outreach into the schools and working with that way. And we have a ton of ideas that have worked in prevention in other counties that we'd like to implement here in Scott County. So building those, going back to building those partnerships, that's helping us get into the schools and working with youth and students and having them at the table and working with us on initiatives. Does that make sense?
That sounds great, yeah. Another question I have is, earlier there was a discussion how the vaping, can be considered a gateway, moving on to marijuana and so be other areas. One of the graphs here shows where did the youth acquire the vaping, the e-cigarettes. And it appears that the retailers do a great job of checking IDs for the youth. But seeing the one graph, most of the vape or e-cigarettes are actually acquired from the friends. And how do you really go about controlling that? It seems like that is so much more difficult because it's just prevalent everywhere then.
It's extremely difficult. It's, I think that our liquor stores and for the most part our bars do a pretty good job of looking for IDs. And yet underage drinking is gigantic. So kids are going to get what kids are going to get. The interesting part though is the more readily accessible it is, the easier it is for them to get it. And I often wonder if we started making alcohol that tasted, I think we do with wine coolers, but if beer flavors or hard alcohol flavors started to be renamed as mother's milk or straw nanners, none of us would stand for that. We would look and say, you are targeting kids, and we're not going to allow that. And yet we have a multi-billion-dollar industry who has now found their way back in to our kids, and somehow we just allow them to do that. So you're right. I think our places of business try to be responsible, but the more access and the more prevalent that we allow it to become, the addiction rates and the use rates are going to continue to go up.
And just to add to that, education is going to be key. For peers, especially with parents, because a lot of the times we have parents that have gone to the schools and yelled at the schools, like, give my kid back their vape, it's just flavored water, and there's a misconception out there that it's nothing in there. And then it is important to understand that there's hard metal particles. There's formaldehyde and stuff like this. You can get popcorn lung from the flavoring. There's some damage that happens from that. It doesn't seem to youth, it seems like, oh, but it's bubblegum flavor or things like that. The education is going to be key for not only the youth, but also the parents to really understand what is actually in those juices that are out there. There was a big push with the Juul company specifically because they were the first ones to come out and in 2 years became multi-million-dollar industry and doubled their usage rate in a lot of places and a lot of youth because they were specifically targeting youth, and that's how the FDA targeted them, and they weren't able to plead their case that they did not target youth because they were paying social media influencers. So that was a huge thing. And the kids see that and they're watching it like, oh, it just looks like this vape they're playing with. They have actual games that they were playing with, like this vape, the puff will come, you can manipulate it and they make games out of that stuff. So, it's harder for us because we're trying to pull away from that attractiveness, but making it less accessible, making it less attractive, making it less affordable. Those are things that you have to take in place. And I also look at this vaping issue like the simple tobacco and cigarette issue. They've come back through almost exactly the same way that they advertised for tobacco starting back in the 50s, 60s, 70s. They've started it again through this loophole of vaping. And it wasn't really quick that the tobacco shifted and all of a sudden we have a generation of kids that don't understand and can't fathom the idea of smoking in a hospital or on an airplane or in a restaurant. The Applebee's, that used to be the smoking sessions and smoke-free sections, and then you talk to the kids about that, they're like, there's no wall there, so it would be like smokes everywhere, right? Yeah, and that was an issue, but they can't fathom that idea, and I maybe aged myself on that too, but it was a long road for that. So it's not giving up, it's working together, and it's going to take a little bit now, but it's great that we are able to have more access to you through social media to really try to educate them on what they're actually doing to their bodies instead.
Going along the lines of restricting, I was intrigued on objective number 6. You have the number of Scott County cities with T21 policies. Currently, there's one city with a target of having 6 cities with T21 policies. Looking into this, I wasn't aware, but it appears the president did sign a T21 type item back in December of 2019. I didn't realize, so is it illegal right now for anyone under 21 to purchase e-cigarettes?
It is.
I didn't realize that. And what's the difference with that and with the city having a T21 policy?
I can take that. So last year on Valentine's Day, Judge Wilton, myself, Jamie Carlson presented to Scale, and we presented that information, actually. We presented that President Trump had put into effect in January of 2020 a T21 policy, which federally says anyone under 21, it is illegal for them to purchase tobacco products, including e-cigarettes. With that being said, all individual municipalities have to put into effect their own ordinance and actually to enforce that. So the language in each individual city in Scott County does need to make sure that it's regulated with that. There do need to be signs and different things in the vape shops, in the tobacco gas station area that say they cannot sell to anyone under 21. They are expected to check IDs. What I can tell you is that looking at some other data that we've received, it's done very little, if to nothing, to prevent youth vaping use because, again, the target with the flavors and the accessibility for people being willing to purchase, and et cetera, has continued to be an issue. So that's why they're moving forward then, like, for example, Prior Lake, and continuing to enhance the ordinance from just, not 21 years of age, but getting rid of those products entirely for sale.
I can add to that also for that federal regulation. I can't prosecute that. That's a federal regulation, and the chances of the feds coming in and taking a violation of that under 21 violation is slim to none. But I can prosecute an ordinance violation.
I don't expect the DEA to start heading to the smoke shops to check out who's selling to 21 and under, and that becomes the bottom line. The other thing is there were lots of promises to make that pretty strong, to make that T21 and go after the flavors and everything else. But that tobacco has some powerful lobbyists, and so really it was just an appeasement to say, here's the 21, but knock yourself out and do what you want.
The other thing that it did or didn't do is, so there was one product, Juul, who you've heard of. Juul has the devices that kind of look like the USB port. So they came with 8 little cartridges, tobacco, menthol, and then 6 other are flavors. So part of that ban of T21 eliminated the 6 other flavors of the Juul, but allowed tobacco and menthol. Well, really what people have learned to do, and you can take a class on it on YouTube, is you can buy the vape juice in a bottle and refill the cartridge with whatever flavor juice you want, and then just continue to use the same device. So you don't even have to purchase a new device. So it was for optics, mostly.
And none of that's illegal, but you can't use the little Juul cartridges, but you can refill them and you're good to go. Makes a lot of sense.
All right, thank you. I'd also like to look at this outcomes page. Looking at objective 7, I wanted to talk a little bit about some terminology in the last section. So one of your markers for progress or success for this grant is the number of successful referrals to treatment from a jail screening. And I'm wondering if someone could tell me what a successful referral Like, what constitutes a successful referral, first of all?
It's going to be Lisa or Dr. Wilcox.
Yeah, this is Mike Wilcox. I can assist in answering that question for you. One of the positions that I do have at Scott County is medical direction for the jail. As a result of that, I provide a clinic in the jail system each week. And of course, I do medical direction also for public health and community health. So, a partnership between public health and the jail in handling these issues of chemical dependency, I think is a very opportune way to deal with these issues once our prisoners are discharged. Let me say this, my program of medication-assisted treatment actually kicked in January of 2020. At that point, I achieved a waiver in my DEA licensure to prescribe a product, Suboxone, which is useful in handling addiction to narcotics, heroin in particular. And as a result of this, once we had individuals who would enter our facility there with a heroin addiction, and in particular, if they were already on this product, Suboxone, we could continue to use it within our jail system then to get them through the time where they could potentially be discharged back into a clinic setting. As Judge Wilton had mentioned before, prior to that time, we were unable to do that. And if we had folks who were addicted come into our facility on Suboxone, we had to discontinue it, put these individuals through a detoxification program, and then deal with their criminal activity in a manner that was prudent and appropriate. This at times then, as Judge Wilton had mentioned, would lead to them being discharged, and they'd go right back on the street and they'd become chemically addicted again. So adding this component to our treatment plan for our addicted patients within the jail system has been a very positive thing. Now, as was mentioned, of course, once the pandemic hit, the number of individuals who entered our jail system decreased significantly. And there was a time actually by March of last year where our jail population dropped about 75%. And it led then to an issue of inability really to treat aggressively these folks who were already chemically addicted to narcotics. At this point, our population now has increased to about 67%. And this is what we're doing now then with this increasing number of residents within our jail system. Many of them have a mental health issue. Many of them have codependency related to chemicals as well, chemical dependency. And if they come into our facility and they have this as an issue and they are already on Suboxone, we will continue to keep them on that product, making sure then that upon their discharge, that they can go back to the clinic of record who prescribed this medication for them originally to continue appropriate follow-up care. So individuals that are Scott County residents certainly have that option available to them. We also have quite a number, however, are entering our jail system from Ramsey and Hennepin counties. And what we're doing now in that setting to provide continuity of care for those individuals is interacting with the chemical dependency units in those counties to make sure that upon discharge from our jail, when they go back to their counties at Hennepin and Ramsey, they have appropriate follow-up in a chemical addiction clinic to continue their Suboxone usage in that type of setting. As it stands right now, I would say we have within our unit about 5 individuals presently using Suboxone as they get through our court system. It is demanding quite a lot of our nursing staff to make sure that there is this continuity in place of initial treatment in our jail system with a handoff, a warm handoff to a clinic upon discharge. It is important that they have that. We cannot continue prescribing Suboxone without a handoff to a clinic upon discharge that's reasonable and appropriate for follow-up. So I really do take my hats off to our nursing staff within our jail system who do this handoff in conjunction with public health within our county and then within the public health system within Ramsey and Scott counties as well. This use of this Suboxone product also demands close observation of its utilization. It potentially can be abused if our prisoners do what we call cheeking the product. And so it demands then our cell officers to be very watchful of this potential issue as well. But putting all of these things together, as Judge Wilton has mentioned, I think gives our folks within our jail system who are addicted to narcotics, heroin in particular, an opportunity to continue their treatment plan in the jail system as they get through their criminal court. And they can then, upon discharge, have appropriate follow-up within their clinic of record as well with that warm handoff.
Sure. Dr.
This
Do
is
we have
Lisa
an effect?
Brodsky. Oh, I just wanted to add, is it okay if I just add something?
Yes.
Success for us really is creating that system for our for individuals to be successful. Part of the ability to continue medicated assisted therapy in the jail is funded through a generous grant from the UCare Foundation. And that also enabled us to offer stipends for physicians within Scott County to be able to get licensed to do medicated assisted therapy, particularly Suboxone. We had very little before. I think we've more than doubled the number. We've gone from, I think, 1 to 3 now within Scott County, so people can stay in their community, particularly those that have transportation issues. We've also increased the capacity of our jail to do screening. We have a half-time person over there right now screening people upon intake to identify if they do have a need for some kind of treatment. They're screened for mental health. They're also screening for substance abuse. So it's really that early identification and getting them on the trajectory to be successful. And when there is a wait for treatment court while they're sitting in the facilities, we've enabled them to start their road to recovery prior to even entering treatment court. So it really is creating a pathway for them to be successful.
Chris, I just want to add one thing too. So prior to me being a county employee, which I just started in May, I taught in the Scott County Jail every Friday for the last 3 years, a Celebrate Recovery class as a volunteer, which is basically a 12 steps class, but it's faith-based. And we were only January, February, part of March teaching before COVID, and the jails have been shut down. But having MAT in the jails as a volunteer and as a teacher has been a game changer. Like, it goes from people laying on the desk because they are withdrawing and they are drooling on the table and they are sick, but they are desperate to be around people that are going to encourage them and speak life to them. It's moved us exponentially. So I'm excited to get back to the jail in some capacity to do that. But just in that short 3 months that we were there, the people that were able to start kind of their safe, sober living situation in the jail, because believe it or not, the jail is a really safe place for people for a short period of time to kind of reset, get the medical attention they need, get a plan in place, get support systems set up, whether it's in this county or their county of residence, has been a huge thing as a volunteer. So
Thanks, Katie. Do we have a decent data collection system about the MAT outcomes as we go forward? That's one of your measures here. So do we have a data collection system that will help us track that a year from now?
I can say regarding what Lisa was talking about with the part-time person doing screenings in the jail when new people get admitted to the jail, that system is in place to track who is kind of referred to treatment. So we, through that person in the jail, will know who she referred and if they ultimately ended up getting connected to treatment.
Do we have any kind of screening for substances, not for MAT necessarily, but do we have any kind of screening for juveniles who are booked through the jail?
Yes. Yes, anyone entering our system is screened for chemical dependency, no matter what their age. Yes.
Did you have other questions? All right, and I just wanted to ask one just really quick question. So the there are a couple of slides with this page. So students with social competency and students with positive identity. So I'm wondering if there are any specific strategies. You know, we talk a lot here at Scott County about the value of kids being connected to a caring adult and having supports around them beyond their parents. As you as you have put together plans for the grant, are there specific strategies for building competency in youth? Like all of the writing that you did for this discussion today talked about the ability to have kids be strong and say no and identify risk. And do we have strategies directed at those things?
Yeah, we just, again, like working with getting into the schools and working with the schools on opportunities to meet with the youth and the school counselors and whatnot and see, first of all, it's that assessment period of really assessing what is it that the counselors need from us. And what we've been hearing is they need to know the resources that are in the area. They need to know what are options once they recognize a kid that's struggling. For us, it's also building those relationships with the youth because they have identified, and I probably think when the school sees those statistics of when they're asking, do you have an adult at school that you feel that you can trust, and that number seems pretty low. So really that identification and working with the schools on how can we get that number up. Also, working with the youth and making sure that they have an idea that we as a prevention group have, there's that fear that there's a punitive part of speaking with somebody from the school, but knowing that there are other people in the community that do care, and that a coalition that is formed by people who do care about our community and want our youth to excel and thrive. There are options out there for them to be able to build those protective factors so that we can reduce all those risk factors of them going into substance use, and why that's important that they know that there are people that have resources, that have answers for them, that can help them. So really getting in there and building those relationships within the schools. Education, of course, that's a big key. Offering our services to the school to go to health classes. If the teacher has a subject matter or a session on substance use, bring us in to work with them on that. And I found that in other schools, when I've done things like that, the youth do contact us after we've gone into the schools and they recognize, oh, this person isn't someone from the school, so I'm not going to get in trouble if I say, I'm really curious about this, or I'm concerned about my friend. And then we can connect with the schools and say, this is one of the issues that we're seeing and the kids are identifying. Having focus groups with the youth has been really great for us. In the fall, we did that in October, and sort of breaking down those walls and opening those doors to, there is a group out here that really does care, and we're trying to do the best we can, but we need your voice too.
I think also that's where
I also want to add,
so with churches, youth pastors are really important. I think cultural organizations like the Somali Center that we have here in Shakopee, they have created a youth group that they've asked us to come and participate in and do some education. So I think it is the schools, and I think it is also the other additional community partnerships. Sorry, Lisa, go ahead.
that's okay. There's no raising my hand on the options that I have here. I want to add that Choose Not to Use is also one of our coalition partners, and they're part from the old Scott County Prevention Task Force, and they utilize are in many of the schools with the Courage to Speak curriculum, and that really focuses on teaching social competency. It teaches them healthy decision making, how to resist pressures to use drugs. It engages, it's a risk reduction program, problem solving, and engages parents in those discussions. And right now it's in several schools, including elementary, middle, and high school. I'd like to see us in all of the elementaries. I have to get an update to see where we're at with that. But it really is that social competency, teaching those social competency skills to kids. And Ron, if you want to say more about that, you've been very involved in that program.
Sure, excuse me. Sure, we are in many of the schools in Scott County already, the middle schools, grade schools, and high schools. A little bit issue getting into the Prior Lake high schools and some of their schools. I had a meeting with actually them and their administration last week, so we're hoping that might get some traction there. And one of the things that, even with the schools that we are involved with, one of the great things about the curriculum that we have in there is it has a parent-adult component to it. And that's one of the things I'd really like Choose Not to Use, and with partnership with public health, is more education to the parents, to the adults. And that's been a difficulty that I've had getting the word out to the parents and getting them to participate, especially with the COVID now, because we can't have a presentation, say, at a high school auditorium. So I'm hoping once COVID goes away, we can get back to some semblance of normalcy, that we can have more programs specifically targeting adults and educating them, like even with the vaping and the alcohol use, because I think there is information out there where parents do think vaping, oh, it's just water, they're just steaming water, who cares? Well, that's not the case. So one thing I would like to expand is more adult education. And I think what was just mentioned with the church groups, I think that would be a great avenue to explore with that.
I think a positive of COVID is that we've relied really heavily, we being prevention, we've relied really heavily on schools to do some of the heavy lifting for us, and now that they're overwhelmed, we have to be creative of how we're going to do that, right? And I think that that's a positive thing. I think there's a lot of fraternal organizations and youth sports organizations that would entertain a 15-minute presentation from us, any of us, right, before their child has to sign up for baseball or they're working at a concession stand or whatever. So I think a positive of COVID has been to not rely so heavily on some of the previous measures that we've used and to get creative of how to reach people, with kind of the schools being taken out as the middleman just because they're so overwhelmed. But
All right. Mr. Chairman, I think it's probably time for me to turn this back to you. So I think we'll pause here.
Okay, boy, it's a lot of material, some big issues. Comments or questions from the board?
Mr. Chair, just one comment, one question. All really good information. I agree to so much. Katie, I like how you just spun, and I don't mean spin in a bad way at all, the difficulty getting into schools during COVID and how that's helped us, because I agree. I think we've relied on schools because, you know, kids are held hostage there. They're there. We can do it. But some of the kids just in my life and experience who need the most help, they're safe in school. You know, it's kind of like getting outside of school and figuring out how to help kids. Sometimes school, for those kids most in need, it's just a mechanical get through the day, and I don't know if we're always reaching them there. So faith organizations, community organizations, just the places that offer services. I really applaud that, and thanks for bringing that up and looking for those innovative ways to reach kids and their parents. And then my question was, and this is just a curiosity, I cannot believe how many, it used to just be, 19 and 20-year-olds in college with the fake IDs. But fake IDs, you can get, I mean, it's an industry, and there's a lot of teenagers with fake IDs, high school students. Has that entered the discussion at all? You know, any education for establishments on, it's amazing, just from how many kids have them.
Well, one of the things that I've done in other counties is it's a safe server presentation that I do with law enforcement, and I'm looking at trying to do that here in Scott County, and it just gives an option to educate the servers and the establishments on how to read, how to identify fake IDs, just enhance what they already have to do to get their licenses. Yeah, that is a difficult piece, and I know that I've seen law enforcement with stacks of all the different kinds and how they've, online has led to a huge issue in that, and they're so good, even with like the holograms and those pieces, it's incredible, but there are still ways for them to identify those, and it's just really getting into with the establishments and working with them on how to educate their employees, and a lot of the times that seems to be like a difficult thing for them to do to get that, so maybe working with them on getting it a part of their orientation and having somebody outside, so it's not their responsibility, helps get that into their establishments and helps us be able to also get to be a part of the community, because it's not just, I mean, everybody in Scott County, including the businesses, are a part of our community, and they all impact, especially if they're an access point for our youth. We want to make sure that they're at the top of their game to deal with this type of stuff.
Well, your point is great, which is, how do we measure that? Because for $35, you can get on the internet and send a picture in, and you will have a West Virginia ID that will pass every single test. And so when I take that from West Virginia and I go into the vape shop as a 14-year-old, and they look and say, "You're 29, you look like you're 14, but you're 29, what do you want?" And they buy a carton load and they push the cart out. That's exactly right, and they hand it all out. How do you measure that? And none of our youth are going to say, they're going to say, "I got it from my friends." They're not going to say, "I have my fake ID that my mom and dad don't know about, and for $35 you can get one too." And so that's a difficult part here is that, um, you can see what you want to see. And in the end, you have to sell products, you have to sell whatever you're going to sell. And so how hard do you look? Parents clearly have no clue that these kids, have a fake ID or that vaping's bad, et cetera. And so that's a super difficult one.
This is Lisa Brodsky. We just really kind of chip away at this one problem at a time, and access is a huge issue. Education is key. When I did prevention in this area 20 years ago, probably 45% of the kids were getting substances, drugs, alcohol directly from their parents. We've morphed and changed over the years, and the more education we do, the better. The more, the less I see them showing the slides about the Dropbox, the less substances in the home, the better. The more people know about how to look for fake IDs, how to, signs that your child is on drugs. I mean, it really is one thing at a time. And a lot of it is related to access, limited access, less availability. So, I haven't really thought about the fake IDs. We won't talk about how many of us may have had them ourselves growing up. But back then, it was a lot harder. It is so much easier now to create fake IDs because of the technology that we have. So definitely more education is needed, both on the parent side and the server side.
Well, with all the negativity that we've talked about today and all the disasters that are about to come, I'll tell you what, with this group and with what's been put in place, we're in a good position to fight and to get our hands dirty. I mean, to get out in the community and do those things that can make the difference and not sit in our towers and write orders and tell people what to do, but to get out and actually do it and push. And, at least in my way of thinking, we have a fighting chance, and we're not going to save everybody, but there are a number we will save. So that's positive.
If I could comment on that fighting chance, those words. Earlier on, there was an idea, almost throw our hands up in the air. It's not if, it's when, and I know that I understand that statement and the potential reality there. But, I grew up, I'm going to date myself, older than the judge did for himself. I grew up in the hippie era, so that really dates me. And I've seen friends, family members, relatives devastated permanently by marijuana and other drugs, but primarily marijuana. I had a high school friend that I don't know if he ever left the basement of his parents. He smoked dope and played his guitar in his basement until he died. And so I'm wondering how to fight as an elected official. Obviously, I live in Savage. My state representative put forward a bill to legalize marijuana. And I got to tell you, a while ago, maybe a year or so ago, I put some data, an article and some data on Facebook about marijuana in Colorado and the impacts. And I was mercilessly pounded. I mean, I was just attacked. I had to take it down. It was pretty horrible. And so I'm wondering and as elected official, how to fight. I mean, I'm thinking we need to have some kind of presentation at scale with all our elected officials and make our elected officials more aware of these issues in a little more comprehensive way and have some hard data that we can fight against this effort to legalize marijuana. Those are just my comments. If anybody can respond to that, that'd be great.
I would I would say that we would absolutely love to do that presentation. I think as an elected official, you have the most important job of what's coming down, because what I've learned in Prior Lake with the ordinance right now is that it's much easier to put an ordinance in place restricting something before it comes, instead of after it comes, with the fear of legal repercussions for your city. So absolutely, as we are working our way through Scott County in, educating with vape and having potential ordinance changes, we will absolutely be doing the same thing before the marijuana legislation hits. The pushback always is, right, like, let it be. Why do we have so much of government oversight? It's always the same arguments of, why can someone be 18 and be in the military and then they can't smoke marijuana if they want to? And it's for all the reasons that you just said. So we would absolutely love to do presentations, go city by city and educate them on the effects. Lil and I were just talking this morning about, in case you're unaware, there's 3 different kinds of marijuana being sold at the dispensaries. The first one is indica, there's sativa, and a hybrid. So indica is the downer, and sativa is the upper. So depending on what you want to do with your day, if you want to sit on your couch, you would go to a dispensary and buy a certain brand. If you want to clean all day and watch, 16 kids and have a lot of energy, you're going to use the other one. The hybrid is the combo of the two. So why we're passionate about this topic is because we've said it's not your grandma's marijuana anymore, right? When it has 85% potency, there are some significant dangers to people, to the community, to driving under the influence, right? And so I think we absolutely have that information, specifically from Colorado, that we can share. There's also a lot of financial implications for that. For example, the dispensaries in Colorado cannot put their earnings into an FDIC bank because it's not a federal. It's illegal federally.
It's illegal federal.
So people then are looking for other ways in cash, in their profit, to invest. And so they're investing in property, in commercial property, which they're paying for in cash, which they can invest federally in a protected FDIC environment, which has raised the cost of properties exponentially because the dispensary owners have kind of cornered the market in terms of using their cash and their profit to purchase. So there's a lot of unintended consequences or unforeseen consequences, perhaps, that we can absolutely educate on as well, in terms of not just the public health impact and the public safety impact.
I think there's that piece of it that's like, if it gets legalized, we've had youth tell me, including my son, Mom, it's legal everywhere else. Like, why are you even bothering me? It's because the impact on youth is my focus. Youth substance use is my focus, prevention, and it'll always be that focus. And just because alcohol and prescription drug is legal doesn't mean that I don't have that as a part of my job. It's a huge part of my job. And I will continue to do that type of work because it is important. And I think, again, here we go back to education, and there are a lot of lessons learned out there. And I'm sorry for Chairman Albright for having to deal with that kind of backlash, but it is something that's going to happen. And we're not always the favorite people, but we have a job for a reason, and it's an unfortunate job security, but we will be doing this type of work, whether it's legal or not. But like Katie said, it's the getting things in place, those safety nets, those safeguards in place prior to legalization to make sure that we can mitigate some of these issues, like potency issues, which is probably the bigger part of what happened with legalization in Colorado that we've heard of, that people thought they were just, it's the 3% type of thing, but they didn't realize the potency could get up to 95%. And what does that happen? How is that different? Well, it impacts differently. I've heard law enforcement talk about it, and that it seems like it's a synthetic drug, depending on your chemical makeup, on how it impacts you. And I watched a video of a youth who had killed someone who was on a motorcycle in Colorado, and his interview with law enforcement after he did that, and you would have thought he was on meth. I actually thought when I was watching it that he was on meth because of his behavior being so erratic and hyper and whatnot. It's not the same. So it's important for that education piece to get out there, that it's not the revenue that's coming in for legalization that's going to magically fix everything, but there is a consequence to it, just as it is for other substances. You have to sort of weigh that, how much money are you going to be putting into treatment and recovery because something is legalized like this, and you better have something in place. So that's where we want to get ahead of it.
And I think the more places you legalize it, the more likely kids are able to say it's fine, right? It's legal here and here, which means it's fine. And I think taking a stance as cities and as a county is you're saying, well, legally, maybe they're saying it's fine here, we're saying it's not fine for us.
Okay, more comments or questions from the board?
Well, almost. I have no idea where this is going to go, and I almost feel like I should take a 24-hour rule, you know, let things kind of mellow. What we're talking about today, I know this applies to a lot of different things, but we're talking about drug-free communities. But the tactics employed, it just seemed gross. Not saying your work seems gross. And it just seems like there's so much more going on than what meets the eye or what that we've even discussed here today. Like my heart's pounding, I got a pit in my stomach. I might actually swear, I don't know, I don't swear, but you never know. It just feels evil to me. And I'm not talking about self-righteousness or holier than thou, but it feels evil. And I get the whole idea of free choice, like I'm a big free choice, free will, but I'm also kind of ticked that some of this behavior makes my health insurance cost more. It costs me more, and I try to be a giver, try to be practice personal generosity, but man, when I don't really have much control over this, it ticks me off. So, because I sit on this, so I'm perhaps slightly biased. I'm a liaison on this particular committee.
Wednesday.
On Wednesday. Let's talk about tonight. There is a public hearing. What time is that tonight?
7 o'clock.
7 o'clock. It's Prior Lake City Hall. So again, we're talking about drug-free communities, but again, the tactics like this are used in evil ways and costs us all money. And if there was some way, I'm all for free will and free choice. If there was some way where somebody wanted to smoke pot or do some illegal activity, and you could put them in a box and they can go do their thing and they're not going to hurt anybody but themselves, God bless them. You probably won't, but nonetheless, as long as it's not hurting me or costing us money, this ticks me off. So thank you for the good work that you guys do. It's a lot of pick and shovel work, and we need to take responsibility here as well. Where's that balance of, hey, I want you to be able to do what you want to do, but man, I try to do some research, like, is there any positive effects of vaping? Like, is it good for your immune system? Does it make you stronger? Does it make you run faster?
Did you find any?
Haven't found any.
You
Haven't
won't.
found anything.
Stop researching. You won't.
Exactly, but in mind of this public hearing, I'm like, is there any, you know, the internet's got to be true, right? And I haven't stumbled across anything yet.
I will tell you that our neuropharmacologist who is presenting tonight will tell you the positive effect of vaping is that it helps smoking cessation for someone who has been a lifelong smoker. And so it helps them taper off traditional tobacco in a way, moving towards cessation. That I believe the average age was 50 to 62-ish was the age that was a benefit for. So there is your benefit for vaping.
I found that one.
You're welcome.
I did, but that's not 18 or 21.
No,
Right.
no, absolutely not.
Right.
So I did find that I'm going to use the positive effect of vaping for that cohort or whatever you want to call it. Not for 18, not for 21.
Absolutely not.
So what we're trying to do here is try to keep honest people honest. You're trying to kind of put some barriers and guidelines. Okay, is this going to push the black market? I suppose if somebody wants to get it, they're going to get it. But the deception involved with this, and my story is walking outside of City Hall, had a meeting, and it looked like a USB type device in the road. And I thought, well, I'm parked right next to the cop shop. I just came from City Hall. This might be somebody's device carrying. And I grabbed it, it's sticky. I threw it in my floor mat. I'm like, what is, it didn't dawn on me for like 2 days because I was going to bring it into the City Hall. I'm like, wait a minute. Because I didn't throw it away because I thought it may, no, that's not. Or what's the thing with the strings on a hoodie?
Sweatshirt, yeah.
Yeah. Let me cinch up my hoodie. No. That's come on.
Yeah.
It's just deception. It's pure and simple. And if it's something that's so great, then why do we got to hide it? That's my little tirade, not really a question. Good work. And golly, enough is enough.
There's one other thing I'd like to mention, going back to Commissioner Ulrich's. There's something called the PACT, P-A-C-T, PACT Act that's taking place. It's going into effect, I should say, in March, so next month, which is, as it relates to vaping, cigarettes, tobacco. If your city has an ordinance that you have banned flavors or whatever you've banned, the United States Postal Service can no longer ship if you've purchased online to that address because they can no longer do the age verification. So that's a positive in terms of vaping, cigarettes, tobacco. To talk to your point about the black market piece. So that is a positive effect that could have some pretty far-reaching effects, countywide, statewide. But otherwise, yeah, there's some sticky situations out there.
Anyone else? Well, thank you very much. It's really powerful presentation, very important issues. We have to get together and huddle on these topics and see how we can work more powerfully together, I think.
Thank you very much. Thank you this morning.